Hi, everyone. Thank you for coming on a Sunday, no less. Before we do anything, I would like to start by acknowledging the Wurundjeri Woi-wurrung people, the traditional custodians of the land that I'm streaming from today. We're obviously all streaming from different places. And I'd like to pay my respects to the elders, past, present, and emerging, and also extend that respect to any Aboriginal or Torres Strait Islander people we might have with us today. We're talking about mental health today, and because it's a panel and we're talking about mental health and particularly mental health illnesses and their treatments, some of the content we're going to cover could be sensitive to people in the audience. And because we're having an impromptu discussion, it just means that we do have a list of content warnings, but people might find sensitive.
Yeah, absolutely. So just some general content warnings. Obviously, we'll be talking about various mental health disorders, and this could include things like schizophrenia, depression, anxiety disorders, addiction, and then, of course, their treatments. So antidepressants, antipsychotics, psychotherapy, behavioural therapy, mental health institutions. Also maybe touch on things like suicide, suicidality, difficulties in learning and memory and attention. And then also another topic will be probably around animal research. So animal models of mental illnesses and experiments involving animals. So if any of that is you consider sensitive information for you, just be aware that those topics will likely be covered in today's discussion.
It's a long list. There's no quiz about that. But I guess one of the beauties of doing these online things in the time of COVID is that you don't have to stand up when you want to, if you want to slip out and have everyone watch you because they've got nothing to look at. You can just pick up your device and like throw it across the room if you want, or there may be like a healthier way to deal with it. And we might cover that today, but we'll see. So I'm Jack. I'm a creative producer and I get to do a lot of work at the Parkville campus with Monash, doing interviews usually for videos. You might have seen some videos on like social media or the website that I've been involved in. And as I said in yesterday's COVID panel, it just means I get to talk to people who are like eminently much more qualified than me and usually were always a lot smarter than me, which is very cool. And again, we've got a bunch of them here today. So we've heard a little bit from Cassie. Kevin, do you want to tell us who is Cassie? What is their deal?
No, I'd love to introduce Cassie. So Cassie is currently a third-year PhD student. Interestingly, she did complete her undergraduate at Monash as well. She did do a Bachelor of Pharmaceutical Sciences, and she actually just missed me by just 1 year. So we're from when she graduated and when I started university. She's currently undertaking her PhD, from my understanding, in testing a new class of antipsychotics for schizophrenia, and using some pretty new technology using touch screens with mice. I think I've also gotten down that Cassie is a huge advocate for mental health awareness and I guess a huge advocate for destigmatization as well.
Amazing. An impressive person, no doubt. And Cassie, it looks like somebody named Dan is in the group. Who is this person? How did they get in? Why are they here?
Yeah, of course. Thanks, Kevin, for the introduction. So I'll introduce Dan. So Dan's a senior lecturer at Monash and has taught various mental health topics to students for about 15 years. So that obviously includes me, having done the pharm-sci course, but also Kevin, who's doing the pharmacy course. On top of that, he also currently works part-time in a community pharmacy. And is a massive advocate for mental health. He's conducted preclinical mental health research, promoted mental health first aid training to Monash pharmacy students, and just continues to do so in his work as a pharmacist and a mental health lecturer as well.
Excellent. Well, that just leaves us learning about Kevin. Dan, tell us all about Kevin. Who is he? How did you meet him? And what is his exact grade point average, please?
Yeah, look, I can tell you about Kevin. So I've known Kevin for 4 years now, having taught him for 4 years in the pharmacy degree. He's currently a fourth-year pharmacy student. He, like Cassie and myself, is very much an advocate for mental health. He's been the Monash Parkville Student Union president, where he's organised a number of on-campus events in terms of support of mental health, such as Are You OK Day. And he's also a student pharmacist in community and hospital pharmacy. So he's got experience in those sectors as well. And I'm not sure exactly what his grade point average was, but it was probably really high.
Surely. well, that might come up later. The chat, mate, we've got questions coming in from the chat if anyone wants to know things, so we can come back to that question, Kevin. I want to ask you, Kevin, firstly, and the others may have stuff to say about this too, but it might be noteworthy, or at least on the surface, that we're sitting with a panel not of psychiatrists or psychologists today, but we're talking about mental health with people involved with pharmacy and pharmaceutical science. Would people be surprised to learn about like how much that impacts on the mental health industry or sector or a problem as a society?
Definitely. I mean, on my first point of call, when I think of mental health, I didn't think of pharmacy and pharmacists and pharmaceutical scientists as the first name or first profession that jumps to mind, but definitely through learning about pharmacy for the past 4 years and also working in pharmacy as well, it definitely plays a huge role. I mean, people who are started on medications, they go to the pharmacy to fill out those medications. The pharmaceutical scientists make those medications, and we're uniquely placed in pharmacy, if I could speak from a pharmacy perspective, that we're uniquely placed that we get to check in with most of our patients and customers almost monthly when they collect their medications. And it's always nice just to check in and see how they're going with their medications and see if anything needs adjusted or whatnot.
And Dan, you're still in working in pharmacy as well as research. So I suppose, is that check-in actually give you maybe a greater insight or a greater chance to work with people who are undergoing treatment?
Look, Jack, I think pharmacists are very much, building on what Kevin mentioned, we're the most accessible mental health professionals, really, or healthcare professionals that do have dealings with mental health on a day-to-day basis in terms of people that come into a pharmacy. And combined with the fact that we're really the medicines experts means that we are well positioned in terms of providing really valuable information to people about mental health conditions.
And what's a medicines expert too? Because in the age of Google, do you find that people are better informed than they were 10, 15, 20 years ago? I mean, I'm not presuming you're practicing then, but do you imagine that it was a more informed group then or now?
Jack, I was practicing 20 years ago, mate, so I'm that old. But yeah, look, over that time, definitely. So there's a wealth of information that people can look up themselves, which is great, but it's also potentially dangerous in that not all the information people get online is reputable and from a good source. And that's where the pharmacist has a major role to play in terms of explaining to people what or how to take their medicines and explain to people some of the information that they might have read on the internet that may not be that accurate.
Definitely makes sense, an important safeguard, I suppose. And we'll probably talk a lot more about pharmacy and the application of mental health research as we go along. But I want to ask you, Cassie, about the study of it or the science of it. I know my experience is limited, and probably one of the last experiments I did was the paper plane one in year 10, where you threw paper planes off the balcony to test the designs and how far they went. And it was very controlled because you knew the design and you knew the environment. I imagine it's quite different from mental illness and much harder to kind of see the subjects, what makes up the subjects and what the different effects are.
Yeah, absolutely. I think one of the biggest bottlenecks in, I guess, mental health research or any research to do with the brain, one of the biggest bottlenecks is that we have such a narrow understanding of how the brain works, a lot less than we like to admit, I think. But I think that's one of the most important drivers towards continuing preclinical work and work in basic science and trying to understand how diseases work, and then how to understand how we can utilize, pharmacotherapy, so using drugs as therapeutics in order to treat that. And I think that's the more we work on understanding that fundamental knowledge, the better we're going to be able to help patients with mental health illnesses.
For sure. And Dan, how do you then, as you undergo all these studies or as you continue, how do you test whether it's working or not? Because you can't measure the distance of the paper plane. How do you measure it in mental health?
Yeah, it's really difficult, Jack, I think, in terms of measuring someone's mental health. And there's a range of tools available in the clinic that people use, particularly GPs and psychiatrists, to test or to understand a person's mental health. But really what it requires is a long, thorough interview or discussion with a health professional in order to get a really good idea of a person's mental health. And it's not something that's a quick fix or an easy fix. It requires a really good, proper diagnosis, and then sometimes a variety of treatments that are tailored specifically for the individual.
Great. And Cassie, long before Kevin and Dan are out there in pharmacies giving people these possible treatments, how do you measure these results when it's still just a theory, when you're still designing hypotheses in the lab and you actually can't go anywhere near a person yet because it's still just in your brain?
Yeah, absolutely. So when you're first doing initial research into a new therapeutic, like you said, long before it goes into a person, it has to be tested in animals first. And obviously an animal can't tell us if they're depressed. An animal can't tell us if they're hallucinating, and they can't tell us if they're anxious. So we have to rely on behaviours that animals carry out that are reflective of the same behaviours that we could see in humans. So we've come up with a lot of different correlations to kind of compare, what we see in a human versus what we see in a mouse. And I guess one of the key examples is something like helplessness. So helplessness in a human, they can tell you, I'm feeling helpless and I'm not, I'm feeling like I can't do anything and nothing I do is working. Whereas in a mouse, the behavior is usually a mouse, is very apt to scurry around and to help themselves and escape danger and things like that. But when a mouse starts to no longer do that, then we can say, okay, we think that mouse is depressed because they're showing signs of helplessness. So there's a variety of different measures that we take, but we have to model these illnesses in a mouse first, and we need to make sure, yes, they are showing signs similar to what we see in humans, and then we can give them our test compound and hope to reverse those treatments and see, that happy, fun, running around mouse that we saw before.
And then if we one day have a little sort of 80s sci-fi movie device where we can talk to mice or we can talk to animals, will that be enough to solve it? Will the breakdown of the language barrier allow this to be possible? Or is there more to it? Is there more differences between animals and people?
Yeah, there's a lot more. The mouse brain is very, very different to the human brain. And again, this comes down to really basic fundamental neuroscience. Is we're trying to understand more the exact circuitry that involves in the brain that drives certain behaviors. So sometimes even if a mouse could tell us they're helpless, it doesn't necessarily mean that their circuitry driving helplessness is the exact same as the circuitry that drives helplessness in a human. So that's another bottleneck in trying to translate medicines that work or don't work in mice and hoping that they work in patients. But we're constantly trying to improve those measures and how we test that in mice to really improve that translation. So there's no use something helping a mouse if it's not going to help a person.
Makes a lot of sense. And I imagine there are a lot of ethical implications too. Dan, I want to ask you about how you can decide what experiments will mirror up with humans and mice, and what is the threshold for when you can start to introduce things to people.
Yeah, look, I think unfortunately it is required that all medicines that are on the market have undergone thorough review or thorough experimentation in animals for very good reasons. And I should make the point, following on what Cassie mentioned, that all animal experimentation is covered by animal ethics applications, and harm to animals is minimised certainly as much as possible. And so following on from what Cassie mentioned, it's really important to then follow up those important animal studies and see if they do translate in the clinic, and hopefully it does, and hopefully you can get these sort of new compounds that Cassie and others are working on to then better treat patients in the clinic, because we know that there's a lot of medicines on the market at the moment for various mental health conditions, and a lot more will be developed in the future, and hopefully those future ones will be much better and much more individually specific for people and be able to treat their conditions much better.
That would be, I mean, that sounds like the ideal. It's such a big area, and as Cassie said, still so unknown. As we break down all these ideas and like actually make breakthroughs in learning about this, Kevin, can I ask you about what it looks like in the real world? Are you at the point yet where you are actually getting to see this applied? Are you still studying this out of books? Like, what does it look like?
No, definitely. I'd love to talk about that in terms of where all the research and how it reflects and translates in the real world. I mean, I guess the first port of call, even though it's a bit contradictory, I guess as a pharmacist and pharmacy students, we actually prefer it if we didn't see patients on medications. The less medications, the better. But sometimes you do have to be started on medications, and some of the earlier medications that we use, they have terrible side effects, whereas some of the more recent ones have much nicer side effects. And depending on the patient, they might experience different side effects. And sometimes they might just bear with it in silence and not really mention it. But really, when you check in with the patients, or when I work at the part-time community pharmacy, when I ask my patient or my customers how they're going with their medications, sometimes you can find out that, oh, hang on a minute, this is actually a side effect that's terrible. And if we just do this little switch to your regimen, or if we just change you to a different medication, your response will be a bit better, and it will get rid of this terrible side effect, which will vastly improve your quality of life. So definitely there is a reflection between what's happening in the lab and it reflected into practice in the community at the very end.
Can I just jump in there, Jack? I think Kevin's right on the money there in terms of, pharmacists, we're not trying to force medicines onto people. We're very much about, looking at the person as a whole and certainly suggesting a range of non-medicine therapies that might help that person. And that's a really important role of a pharmacist, to do that and to help that person as much as possible in terms of their general well-being, not just in terms of their taking medicines.
Of course, and I imagine that line between when somebody is, when it's a matter of introducing a pharmacy solution, how far away is that line? I imagine when you were both presidents of the student union, Cassie and Kevin, that there was a lot where you would maybe meet someone joining the student union where you might have thoughts about their mental health, or thoughts about how to be a supportive president. And long before the thought of pharmacy interventions came in, Cassie, maybe, is this something that you had to balance when you were in the student union?
Absolutely. So I think when you're studying science and when you're studying mental health, you do get that textbook experience and appreciation for signs to look out for in people. And then when you have been battling with mental health issues yourself and you've been getting treatment for that, which is something that I've grown up with, again, you notice the signs, and you're constantly looking out to make sure that everyone's okay, because not a lot of people have that access or understand that access, and they're just waiting for somebody to notice and help them, because maybe they may not do it consciously, but sometimes people just don't realize that they do need help. And obviously the first point of call is to suggest things like counselling and psychologists, because that's the expert that will be able to find out and give you the tools that you need in order to improve your mental health outcomes. And then if that down the track does lead to a mental illness diagnosis, that's usually when them as experts will discuss whether your psychotherapy or behavioural therapy that you're doing would also be well supported with pharmacotherapy. And we see this a lot. I'm sure Dan and Kevin can attest that most patients that are receiving pharmacotherapies or therapeutics are doing that side by side with really good psychological help as well, because we've seen in all the studies, drugs alone don't do as well as drugs in combination with therapy, and oftentimes therapy alone doesn't do as well as in combination with drugs. So all the studies point towards this combination of both approaches, and that's why it's important to not just see the psychologists and psychiatrists' inputs, but also, from a science point of view as well. So it just goes to show the importance of those of us that are doing the pharmaceutical science approach, which stems back right to your first question at the start as to why are you talking to us,
Yeah. And when we're trying to create that balance between the scientific approach, I imagine there's a bit of overlap, Kevin. Did you go from like the classroom straight into running Are You OK Days and similar kind of events, or is there kind of like a first aid course or something that you can take to try to bridge the science and the real world application?
No, definitely. There is actually a first aid course. So as pharmacy students and students at Monash University overall, we do get access to undertake mental health first aid training. That usually costs a certain amount of money. I'm not too sure, but it is made free and available to students at Monash. So certainly undertaking that course has been a massive help in the community, and also in terms of organising these events on campus, whether it be Are You OK Day or your weekly welfare events on campus, where the main focus isn't about addressing these issues, starting people or your friends on medications, but more rather to start the conversation with them and really building the right protective barriers where you've got the social support right there, where you know that you can turn to your friends, and even though they might not say the right things, you know where to refer to support, and knowing that there is someone there that can listen to what your thoughts are. And I think that's sort of the mental health first aid that is freely available to students was really the foundation stones towards building those events on campus. And those events on campus are also very muchly supported by the university.
And is there ever a tension between the that idea that as a culture we need to be having those dialogues more and having the Are You OK Day style forums versus like the actual hard cash dollar resource investment? Like, is there a two-waged front, a two-waged war against, like, we need more cultural appreciation, but we also need investment and resources?
Yeah, I think I would love to speak to that. I think that the social resources and improving the normalization of talking about mental health with each other, I think is a huge importance. And I almost feel like it's a very separate issue as well to the fact that we need more, funding for basic science research as well, because these are two very, separate issues. On one hand, you have a societal destigmatization that needs to happen around talking about mental health issues and normalizing the everyday person's ability to talk about mental health. And then separately, you have the problem of trying to get funding for mental health research. And I guess the overlap in the Venn diagram, is probably this greater long-term societal, malappreciation for the severity of mental health illnesses. Dan, you can also speak to that.
I was just going to add, Cassie, around those cultural norms and we're in a difficult situation at the moment with COVID-19, and we know that has negatively impacted a lot of people's mental health. But perhaps one silver lining is that there's more of a normalisation of talking about mental health now, I think, than perhaps there was before COVID-19. And that can potentially be a beneficial thing in terms of that appreciation, normalisation, that it's okay to get help, that it's okay to reach out to people, family and friends and healthcare professionals to provide assistance and really important support for people.
That makes a lot of sense. Dan, is this idea that the individual is finding more comfort and COVID is providing more comfortable scenario for people to talk about their mental health? Are you finding when you're actually in pharmacy as well that people are more open about it, just in general, even in a medical setting?
Yeah, I think so, Jack. I mean, we're seeing less people come through pharmacies and because people don't want to be out and about as much, which is absolutely fair enough. But yeah, look, anecdotally, yeah, I think so. I think there's people that are willing to just have that conversation and just asking that question, open-ended questions about how are you going, what, and having those difficult conversations. And if I may say, that's what we're really trying to instill in our pharmacy students about the importance of communication and having the confidence to have those difficult conversations and about really sensitive topics. And that's what we're really trying to develop in our pharmacy students in particular.
And the ability to just have these chats that are well-informed and doing the mental health first aid training that you set Kevin up. I believe that was you that set Kevin up with doing that. How important are those things compared with like learning slogans from Instagram about self-care and about taking, lighting some candles every day? Like, how important is this science prescribed but still very person-to-person oriented care?
I don't think you can really divide the two, really. I think we do know from the science that evidence suggests that there's not one size fits all from a mental health perspective. That what works for one person may not work for another. So if lighting candles and putting on soft music and listening to Marvin Gaye is what your thing, that's absolutely fine. But if venting and screaming and ranting in the comfort of your own home is what helps you, then that's okay too. But I think Kevin might want to talk this as well, maybe.
Yeah, definitely. I'd like to, looking at, I guess, the previous point that Dan brought up about building pharmacy students at being good communicators is, I think one of the greatest joys in being pharmacy and studying pharmacy is definitely just being able to chat to a great diversity of people, see how they're going in their daily lives, and looking beyond their medications, what they're taking, and just really getting an appreciation of how they're going overall in life in general. And it really is one of the greatest joys in pharmacy. And even if you are having that difficult conversation, I think it leaves you quite fulfilled at the end of the day when you realize that the one or two sentences that I've said has really altered the course of this person's life for the better. And I think that's one of the one of the first reasons and greatest reasons I'm in pharmacy overall. So definitely, I think that's a well-supported point.
And from a development of student perspective, I think around, from a pharmaceutical science and a pharmacist perspective, we're really about developing other skills as well, such as problem solving and critical thinking. And that's so important. Cassie, you would have found that, I guess, in your pharm sci degree around developing those important critical thinking skills for your research.
Absolutely. Funnily enough, that was exactly the point that I was about to raise, was that even as a, I guess, back of house scientist, rather than on the forefront actually interacting with patients and customers, is that in being a scientist, in learning those critical thinking skills, in being able to reason logically, and these are all learnt processes. I think in learning those key science skills, it just makes you such an asset to everybody around you. And gives you like a really good sense of responsibility, like in a good way. I know that I'm definitely a point of call to a lot of my family and friends who do not have science backgrounds to ask for my advice on things, and not just from their own mental health issues, but just the other day I got a text from a friend from high school asking, hey, my friend's taking this new medication, they've tried looking up how it works. And it was Ritalin, and they were like, I'm looking things up and I just do not understand anything online. Can I, pick your brain? Can you explain to me how it works? And being able to be that source for somebody and, say, hey, yeah, here's the information. And yeah, I appreciate that the accessibility online is very difficult, but, I can provide that information to you, not just the information, but, I'm not an expert on, those therapies, but I could look it up. I could analyze the data. I could apply my knowledge of mechanism of actions of drugs that I'm a specialist in and interpret those results and then explain that to him. So I think that having those skills are incredibly important and useful.
It's really fascinating, actually, especially like the transition as you go further and further in your career, Cassie, of going to becoming this go-to person, and eventually, I suppose, like this internationally famous researcher. We actually are about to run out of time, and I really can't stress enough how much we're just scratching the surface, because it's such a big, nebulous, like meaty, interesting area. But just before we wrap up, is there any final thoughts anyone wants to leave everybody on?
Look, only that, what we've really talked about, to reiterate what we've really talked about it, and that, you know, in pharmacy in particular, we're about developing students' skills in terms of communication and problem solving, but also learning, getting them to learn about cutting edge technologies. And I'm sure in 20 years' time, we'll look back on 2020 thinking, wow, we really didn't know much about how to treat mental health, and we'll learn much more about tailoring medicines to specific individuals much better. And that's already happening in the mental health space, but pharmacists and pharmaceutical scientists are going to be pivotal in terms of developing that individualized therapy in the years to come.
Amazing. There is one question. Somebody's just actually left a comment. Sorry, I've misunderstood that. And that's because I don't have that brilliant pharmacy analysis brain that you've all got. But somebody wanted to thank all of you for this amazing discussion. This has opened me so much to the area of pharmacy that I didn't know about. And thank you so much. And there's a happy face at the end like this. That really mirrors my sentiments as well. Thank you all for coming and chatting to. It's been very eye-opening and interesting. And for everyone else in the audience, if you want to join the exhibition hall again, there's more going on for open day. Thank you very much, everyone.